Hello everyone. The subject of this video today is hip replacement or not. Well, we have Stephanie here. Stephanie's been seeing me ever since I got into practice 22 years ago. She saw the doctor ahead of me, Dr. Levin, right? And I took over the practice for Dr. Neil Levin, who still practices out in Long Island. I've been seeing her on and off for, well, no, not on and off, on consistently for wellness care for 22 years. She has severe scoliosis. She was one of those cases that didn't brace, they didn't really know how to correct it, didn't want to do surgery. I think they recommended that for you when you were younger?
Not really, no.
No? Okay. Well, she probably should have had surgery, but because of the severity of the scoliosis, her hips have worn down. And a lot of people ask me this question, you know, should I get hip surgery? And I can tell you this, if your hip pain is affecting your daily life, your ability to walk, to do everyday things, day-to-day things, play with your kids, be with your kids and your family, then that's probably the point where you should go to the orthopedist, have it x-rayed, maybe even have an MRI, and take a closer look at it and see where you're at. Now, she had some mild hip pain here and there over the years. Nothing really bad. And then recently it's gotten significantly worse, and it's really affecting the way she walks. And what else is it affecting for you?
Well, pretty much the way I, have trouble sleeping sometimes because it hurts. Even sitting, not just walking, it hurts sometimes. So that's about it.
So we referred her out to, or she went out to see an orthopedist, and she had some x-rays done. It's pretty much bone on bone at this point. She's got arthritic spurs there in the hip, and it's really up to you to find a surgeon that not only does hip replacements, total hip replacement. Now remember, that's more invasive than a hip resurfacing. So there are two different types of surgeries. The hip resurfacing is a newer surgery. I'm going to guess it's been out about 5-6 years now. It's been more widely used in Asia and Europe, and done more widely there, but it's definitely being used here. So in a sense, instead of cutting your hip bone at the neck of the hip or the leg bone and replacing it with drilling a fake neck of a leg bone into there, and then sewing up all the muscles and tendons and then putting your hip back in, what this does is it sort of dislocates your hip. It takes the trochanter, or the ball, there's a ball and then a socket in the hip, takes the ball and it shaves it down and it resurfaces it, gets it smooth, and then takes like a plate, in a sense. I'm not sure if it's made of titanium or not, probably, and it's covers the ball of the hip, and then they stick it right back there in the hip, and then you have to strengthen and rehab that area. Less invasive procedure. Not all surgeons do it, so you may want to get opinions from surgeons that do both types of surgeries. I always recommend getting a second opinion. Did you do that? Did you get a second opinion?
Yeah, I will be.
Yep. So, and even a third opinion can't hurt to do that. And again, make sure they're doing both types of surgeries, or seek someone that does hip resurfacing as well as hip replacements. Again, hip replacement being more invasive. So we've done cold laser on her hip, and that's always been helpful for her, but we're not going to do that at this point, because it's just not going to be as effective when you're bone on bone, and she has so many arthritic spurs in there that it's going to be difficult to fix the issue with cold laser therapy. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.